Alright folks, my name is Dr. Mahajan. I'm an internist, board certified internist. I've been practicing in Pinellas County for 25 years. I have a practice in Largo, on Lower Largo Road. Me and my wife, we are two physicians and we got 4 nurse practitioners. So we got 6 provider practice. And I go to Mahajan Plant and Largo Medical Center. So I'm still around in my hospital, so I'm a dinosaur that way. There's another lady coming, so that'll come in. Come on in. We didn't start. We were waiting for you.
I was over there.
So that's my office manager, Debbie. You want to wave hand, Debbie? If you have any question about the practice afterwards, you can ask. So today we're going to talk about gut health. Let's see. Just things to remember: put your phone on, vibrator, because anyone phone rings, we have to have them give the rest of the talk. So it's up to you. Keep the conversation to minimum and we'll have good time. Alright, so what's on our agenda today? We're going to talk today, as you can see, 4 aspects: similarities and difference between IBS, which stands for irritable bowel syndrome, IBD, which stands for inflammatory bowel disease, and diverticulitis. So those are the 3 main areas we're going to cover today. And what causes those disorders, how you find out if you have them, what can you do if you have them, what can you do, or if your loved one have them, what can you do to mitigate them or prevent them to relapse and recur. And all 3 conditions relapse and reoccur. All right, so just a general overview. If you look at that, that's your big mouth. Okay. Some of us have small mouth. And that's your esophagus, stomach, small bowel. This is small, but this is long. It's just the caliber is small, but it's bigger than the large bowel. And that's your large bowel, and that's your rectum. And oh, come on in. We were waiting for you, and the girl said start, so I just started. Alright, so you didn't miss a whole lot. We're talking about gut health today, so you didn't miss a whole lot. We're just starting with the anatomy. Alright, so if you look at here, the stomach, which is the organ right after your esophagus. In fact, the digestion starts in your mouth with your saliva and your chewing. And then this is just a passage, the esophagus. And then the big heavy lifting happens in your stomach with the acid. It breaks down, and it also prevents the bacteria and viruses to get inside our gut. So this is very important organ, the stomach. And then this is the powerhouse for digestion, the small bowel. So it's very long, and it has the advantage of juices coming from the gallbladder, which is right here, and the pancreas, which is right behind it. So it gets those juices. Right there is the pancreas, the green thing. It gets the juices into the small bowel. So, and another important aspect for digestion is your gut bacteria. The gut bacteria, there are trillions of them, trillions. And if they are not healthy, you're not healthy. As this young lady was saying, mind-gut connection. And that's very interesting because we have a big nerve, the vagus nerve, which wraps around here, goes to the heart, and then goes to the brain. So that tells you the body put a lot of emphasis in interconnecting the organs. For example, if you are nervous or anxious about, let's say, something happening in your family or life or finances, you will see that you get upset stomach. The acid production goes up and you get very spastic and irritable stomach. After the brain nervous system, this has the biggest nervous system, the gut. So that's why if you calm here, the gut gets calm too, and we'll come to those things when we go to irritable bowel syndrome. So the gut bacteria is gut health. That's how important they are. And if you don't, so it's like gardening. If you don't have a good compost and good watering, good sunlight, you don't get good bacteria and you don't get good plant health. Same thing inside the gut. You got to think like a gardener. You got to give them prebiotics, which is like onions, garlic, ginger, herbs. So those are like fertilizers. And then you got to give fiber. So they can get small particles here and they can get entangled like a nest. So they're like birds. You got to give them fiber, otherwise they don't nest, and you don't get healthy bacteria. So prebiotics and then nesting material, the fiber. And then the probiotics. The probiotics are oversold. If I were you, I won't buy them in the market. You got to get your own probiotics. So you will ask me, how? Anything fermented is your best bet. Why I'm saying don't buy it over the counter? The reason being, we hardly know about the microbiome, that's what we call the gut bacteria. So if they have 4 or 5 different strains of probiotics, it may stick, may not stick, because everyone's microbiome is different. You want to give the option to the microbiome to do its own thing, not force a million of certain bacteria which a pharmaceutical company think is good. It may not be good for you. The other possibility is, once the bacteria is sitting in those capsules, they're live or dead. You see, the bacteria needs, yes sir?
You said something about the probiotics. Do you have a comment on yogurt? Or
I'm going to come to that. That's a great idea. Just hold your thought right there. So we don't know what temperature those capsules or tablets have been stored, the probiotics tablets or capsules. So you may be just spending gazillion dollar on something fancy, which they said will send you a bottle in the night infomercial, and that cured, Biden's gut health or something, and then we'll get you a free one next to it, and you buy those, paying $50 or whatever, and you may get garbage. So this gentleman has a very good idea. So what are the good fermented foods which gives you probiotics? So yogurt is an example. Anything fermented yogurt is a great example. Activia is a good brand. Greek yogurt, any yogurt is good. And then kefir, Kefir. Kefir has the most probiotics per ml.
Is that a grain?
No, it's a fermented yogurt kind of drink.
Oh.
It's in the same aisle in Publix or wherever you shop at Walmart
Walmart is cheaper.
Yeah, Walmart Supercenter. This man knows his grocery. Every grocery, even Aldi's have it. The kefir is every place where they keep the yogurt. So if you want to try something, and they come in different flavors, it's easily palatable, good source of energy, good source of bacteria. Most probiotics per ml, kefir. And then other options are, I know if anyone's palate, sauerkraut, fermented pickles, yes. Kimchi, I know if you're in spicy mood, kimchi is good. Any of those things, all of those things will help you get your gut bacteria healthier. Alright, so we talked about the small bowel and the, yes sir.
And what quantities should you be looking at?
So anything and everything in moderation, my friend. Very good question. People go overboard. They drink the whole gallon of kefir a day, and then they get diarrhea. They say, "Hey doc, I took your advice, and now I'm shitting." So okay, don't take it overboard. So moderation, yes, ma'am.
Is cottage cheese good?
It's not fermented, but some of the cheeses are fermented. So I like cottage cheese. It's a good source of protein, but anything which has fermentation. So yes, ma'am.
Like
How do you
fruit?
spell the name of that yogurt?
Kefir, K like kite, Kefir. Kefir.
Kefir. Okay.
Yeah, good stuff. Alright, so we talked about that. The food is broken down in stomach, small bowel, get the help from the microbiome and the juices from the gallbladder and the pancreas to break down the food, most of it. Whatever is left, the colon take care of that, the large bowel, and then it comes out as fecal matter. So the body is very efficient if we let it do its job, and we don't interfere by giving drugs like Prilosec or pantoprazole. It does a great job, but some people need it. But otherwise, you leave it alone, it does a beautiful job. Alright, let's go to the next slide. So, these are the three things we're going to talk about. The irritable bowel syndrome, short form is IBS. Now, the bowel looks normal, so if you get a colonoscopy or small bowel enteroscopy or upper endoscopy, the anatomy they take biopsies, they'll be normal. But you have symptoms, and we'll talk about why you get symptoms. And the second one, your bowel looks very abnormal. So, if they put a colonoscopy or a enteroscopy into small bowel, which is a difficult procedure to look into small bowel, they will see ulcers. So this is not something which is like IBS. The symptoms could be similar, but this is much more devastating. This could be devastating in your lifestyle too, but this is, it can cause cancers if left untreated, so this is serious stuff. Diverticulitis is very common. Any of you in this room had diverticulitis? Raise your hands. Okay, so we got 3 folks out of 10, 12 folks. So it's very common as we age, the gut age, and the pockets in the colon gets the food particle or feces stuck in that, and that causes real pain up here, mostly in the left lower abdomen. And you bend over, sometimes we have to hospitalize those patients, give IV antibiotics. We'll come to the treatment in a minute, and sometimes we need to do surgery to clear up the abscess. So it's not benign. So if you get severe pain in the left lower abdomen, we'll talk about symptom in a minute. It's something you need to address with your physician. All right, so there's another gentleman. We were waiting. He's going to bring coffee for everyone.
Yes, sir. Coffee's on me.
So you didn't miss a whole lot. We talked just the basic anatomy, and we're going to cover the irritable bowel syndrome, the inflammatory bowel disease like Crohn's and ulcerative colitis, and we're going to cover diverticulitis in today's talk. So we are at what's the causes for IBS, and which is irritable bowel syndrome, and the IBD, which is inflammatory bowel disease. So we don't know. So that's the interesting part about these two diseases is we got a lot of theories. Anytime you have 3 + 3 = 6 + 10 theories, that means we don't know. But we have some hunch because we have some treatments. So you got to have some hunch to have treatment. So these are the various theories. We talked about the brain gut signal problem with the vagus nerve, so that we just alluded to. And the motility issues, if the gut is moving slow or fast, and now with the new drugs for diabetes like Ozempic, Trulicity, that's affecting the motility as well. The pain sensitivity. Some people are extremely sensitive to pain. Some people, the truck goes through the legs, they say, no biggie. But some people are extremely sensitive, and that could be a player too. The gut has the pain B receptors, and that could be an issue. The mental health problem, like we talked about, anxiety and depression. So if you're anxious and depressed, everything gets enhanced. Everything become, in your mind. It's not that you're imagining, but the mind is thinking doom and gloom, and the gut, any gas, any indigestion, it gets out of proportion in your mind that you got to address it. It's a panic situation for you. Food sensitivity, some people are gluten sensitive or lactose intolerant. Those are 2 common ones. So that, if you don't know, if you have that, that will cause a lot of symptoms of bloating and diarrhea. Altered level of neurotransmitters and hormones, we alluded to that a little bit. Small intestine bacterial overgrowth. So, if you push a lot of bacteria by not feeding the right kind of gardening material, you'll get overgrowth of something you don't want, the bacteria which are causing the ill health. So that's why I was alluding to taking care of microbiome or your gut bacteria, the healthy bacteria, like a gardening. Prebiotics, fiber, probiotics, fluids. Genetics, some people have, unfortunately, ulcerative colitis or Crohn's disease in the family or IBS in the family. So diverticulitis maybe, may not be, but yes, it could be. So, what are the causes of diverticulitis? Now, if you look at all these causes, these are common with all three conditions. So, not eating enough fiber, we talked about that, that causes hard stools, which increases pressure on the bowel wall, and the pouches get stuck with the hard fecal matter, which is like a stone. If you ever seen hard stools, if you didn't drink enough fluids or had not enough veggies or fruits or whole grains, and you go to move your bowels, you can probably plug up your toilet, and you have to spend $250 for the plumber. So that's as hard as a rock. So if you're getting stools like that, that tells me that you're not eating fiber and you're not drinking enough fluids. So, looking at your stools can give you a lot of clues. How's your gut health? So I know it's smelly, but it's your own shit. Let's see, getting older. We're all older in this room, 40 plus, and that also increases your risk for diverticulitis. And the genetics, we talked about that, taking some form of medication. So that's very important, because how many people in this room has more than 3 pills they're taking, prescription, over the counter? Pretty much everyone, right? All of them medication has to go through your gut, unless you're giving shots, right? Anything which goes through the gut affects the gut, right? For example, let's take the most common ones. Prednisone, for example, steroids. It affects you profoundly from head to toe by reducing your immune system and increase the risk of infections like diverticulitis. Opioids, Percocets, Vicodins, name it, tramadol, narcotics, any kind, slows your gut motility. The gut just goes to stand still. All those patients, and if you ever had any fractures and you took the pain medication, you probably observe yourself. You get nauseous, you get bloated. It's hard to get your BM like you used to get regularly, because the gut is slow. And if you take it for a long period of time, it behaves like, for example, in diabetes, we get slow gut. And chronic opioid gut is behaved like exactly like that. And it's miserable for those patients. So less pain medications, less steroids. Even the over-the-counter stuff like Aleve, ibuprofen, Anacin, aspirin, Goodies powder, all those can cause small ulcers in your gut from your stomach all the way down to your colon and cause bleeding and cause diverticulitis. So, there are a lot of people which come to my office and they say, Doc, I'm not feeling well, I'm eating food and getting upset stomach, heartburn. I said, what you taking? Nothing. I said, I'm not talking prescription. Anything you put in your mouth does not matter whether I wrote it or you bought it from Walmart pharmacy or any pharmacy or Amazon, whatever. Anything you put in your mouth, supplements, OTC drugs, they're drugs. You got to factor that in. I prescribe a heart medication, they say, I don't want to take it. I said, why? He said, I looked at it, there are a lot of side effects. I said, have you looked at side effects of Tylenol, for example? There's 10,000 side effects. Should we take it? Yeah, moderation again, but same thing applies to prescription medication, same thing applies to OTC drug, same thing applies to supplements. People forget. They come to me and they're taking, all kinds of supplements. For example, if you're taking calcium, good stuff, we all postmenopausal or in that ballpark in this room, we need calcium. But some people go overboard. They take, who's going to give the talk? Alright, so they take overdo on calcium, they take more than 2,000-3,000 grams a day, they get constipated. Same thing applies to iron supplements. You take too much of iron supplement, your stool turn black, you come running to me, hey doc, I got blood. I said, what you taking? Nothing. Over the counter. Oh, my friend gave me iron, he has some extra, he got it from VA. I said, okay, that's why it's black. and that's why you're constipated. So we don't think of OTC and supplements as causing issues. They cause as much issues as the prescription medications. So we got to factor that in. Alright, so we talked about the over-the-counter drugs, supplements, prescription drugs, side effects from that. And the last piece no one wants to talk about is unhealthy lifestyle. Everyone comes to my office and I start talking about lifestyle and they say, So listen, it's a two-way street. Everyone wants a quick fix. Surgery, pill, shots. I said, no, you're not going to do, you're not going to do this part. The pills, the surgery won't work. You got to have good exercise. So for example, I go to hospitals, I just said. So I just saw a patient a week ago. She had a colon cancer and she was lucky, it was early and we resected it. And next day I went to see her and she said, oh, I have a lot of pain. I said, yeah, it's going to hurt you for a day or two. I said, but walk. She said, I can't walk, I have pain. I said, no. If you're not going to walk, you're going to be here a week. The answer is, if you don't walk, the gut don't walk. Everything is connected. So, I said, I'm not going to give you morphine, you walk, or I'm going to give you morphine then. So she started walking, she didn't need morphine because, the pain got better, she started feeling confident, and you get less blood clots in your legs if you start walking. So sometimes you got to overrule your body. The body's saying, I just had surgery, let me lazy around. It will cause bed sores, it will cause blood clots, it will cause you constipation. In men, it causes urinary retention. They end up in the hospital, not able to pee, and then we have to get a Foley catheter and we have to send them home with a catheter. If they start walking right after the surgery, they won't need to because they can pee better. When you're standing with gravity, it's easy to pee. So, my point is, you don't do this, all this, the medications and all that, which we're going to come to in a minute, not going to work. So if you're smoking, I tell my patient, I know it's a difficult thing to quit, but if you're attending this talk, I'm pretty sure there's no one smoker here. If you're a smoker, raise your hands. Okay, someone is a smoker, don't want to raise their hand. Okay, that's fine. But smoking affects you from head to toe. It's one of those things. And it's a choice for everyone, but if you want good health, this is the number one thing you should kick. Anytime, every time. Even you are 100-year-old, it will help you. Within an hour, your sense of smell improves. Within a day, your sense of taste improves. That's beautiful quality of life right there. Even you're 100. People say, oh, I lived 100, why are you bothering me now? I said, your quality of life will improve. So, if your best buddy is a smoker, your kid is a smoker, tell them to stop and give them help. It's not easy. It's more difficult than quitting cocaine. So it is very hard, but it's like anything in life. You put your mind, that's the first step, and then it can happen. But you say, then nothing happens. Alright, so being overweight also plays into it. So, why the physicians are obsessed about weight. The thing is, the fat is a live tissue. It's not just collection of fat and you look not as sexy. That's one aspect. But the adipose tissue produces hormones. It causes inflammation. It causes more cancers. So if you think about it, more overweight you are, more the risk of colon cancer, more the risk of breast cancer in women, more the risk of prostate cancer in men. So being overweight has a direct impact on your gut health and cardiovascular health, stroke, which we all know, diabetes, we all know that, but people don't know the association with that and cancer. It's a serious association. And even if you, let's say, God willing, got someone, God forbid, got a cancer, like breast or colon, and you got it taken care of, and you don't choose a good lifestyle with losing weight, it will come back. So the relapse rate is much higher in people who are overweight, unfortunately. So lifestyle changes is the key for gut health and overall body health. Alright, so let's talk about sign and symptoms a little bit. So these are diverticulitis. All three have similar sign and symptoms, so that's why it becomes a little bit tricky. So gas, bloating, constipation, diarrhea, cramping in the belly, constant feeling needing to use the bathroom to move your bowels, nausea, vomiting, and loss of appetite. So that's why it becomes difficult to tease them out which among these diseases you have, and that's where we need a good history, a good exam, and then if you still don't have the answers, then we go to the next step, which is doing the testing. So, there are good tests available, like CAT scan of the abdomen, pelvis. Blood tests can tell us, for example, in Crohn's disease or ulcerative colitis, inflammatory bowel disease, you can see this inflammation markers are up, and these are autoimmune disorders, so you will see the patient may have a history of lupus or rheumatoid arthritis or Hashimoto's thyroid condition. So you can get a clue from there, plus you can do a blood test to confirm. A lot of these conditions can make you bleed, so the patient may be anemic. So the hemoglobin will tell us if the white count is up, that will tell us that whether it's inflammation or infection. And then you can do other testing like the barium studies, and the gold standard is colonoscopy. If you're still not sure, it's most invasive. You want to, if you can make a quick answers, just CAT scan, and you're hurting in your belly on your left side, and you have, previous history of diverticulosis. Diverticulosis is, but a lot of people in older gut has pockets. That's not anything to worry about. Diverticulitis, any itis, pancreatitis, cellulitis, any itis mean infection, inflammation. Osis, is just there. So the itis is what we worry about. So that's, you can diagnose by looking with a CAT scan. The CAT scan is a very good test to look for diverticulitis, and the radiologist can tell you. Alright, so how do we treat irritable bowel disease and inflammatory bowel disease? So the ideas we talked about that, medicine and probiotics may relieve the symptoms. Mental health, taking care of your mind, as this young lady was saying before the talk, by meditating, by deep breathing, by walking, by socializing. Not only it helps you with mental health, it helps you with physical health, and it's not going to hurt you. There's no side effect of socializing. They have a group here, Silver Sneakers, and join any group. Your hobbies. It helps your mental health, helps your gut health. There's a direct connection. Dietary changes. So, for example, in diverticulitis, the nuts, seeds, and corn, don't overdo it. It's controversial whether that's true or not, but some people are extremely sensitive to nuts, seeds, and corn. So, if you have diverticulitis in the past, think about what you ate night before, tease it out, keep a food diary. Sometimes there's a correlation, sometimes not, but I tell my patient, I love nuts myself. They are, what I call superfoods, the nuts and seeds. So you can soak them, and then it's easy to chew, and then the fiber is not get entangled in your colon as much. So you can soak them, put in your oatmeal or something in the morning, along with your berries. Now you got a full, what I call superfood breakfast. Instead of cereal, just think of my words. I said oatmeal. I didn't say cereal. Cereal is a junk food. I know it's quick and fast. Anything quick and fast, spit it out. Anything slow, eat more. Alright, so that gives you a good idea about what to eat, but not to eat. It's hard. Everyone in a hurry, but you want your good health, you got to work for it, and the work starts in the kitchen. So the inflammatory bowel disease, now that's a whole topic by itself. That in the inflammation, the ulcers in the gut, you get pus, you get blood in the stool. Crohn's disease happen mostly in the younger decades. It can happen later too, but mostly in the younger decades. Ulcerative colitis can happen all over, but they're both debilitating. They both make you get weight loss. They're both relapsing and remitting. That means they come and go. and the treatments are there. There is medication to reduce the inflammation. Sometime in Crohn's disease, we have to use high dose of steroids for the acute attacks, and the patient lose weight, they're miserable, and then you got to check them lifelong for colon and rectal cancers because they are more prone to those. So those are serious condition, and you need a specialist to monitor that. But the dietary changes also helps you there. And we alluded to the pre and postbiotic and fiber. So this is about diverticulitis. How can you, if you have diverticulitis, how can you live? We talked about dietary changes, make the food softer, especially when you have acute attack. Give the bowel some rest. Don't overeat for a week after the acute attack, just so that way you have less residual food coming to your colon. That's where the pockets are. So drink a lot of water, soft diet at the first week, and then after that, nut seeds and corn, be careful. Popcorn, be careful. So, fiber supplements, antibiotic, probiotics, we talked about that. Physical rest, if you're really sick, then yes, otherwise I'm not a big fan of that. Liquid diet to rest your colon, we talked just about that. After the acute attack, it's good to stick with liquid diet so it gets absorbed, and less hard stools are coming to your colon, so that this part where you have the pockets, they don't get banged by hard stools and stretched over and over again. And we talked about in severe cases, if you're not responding to oral antibiotics and these things outside, then we have to put you in the hospital to give you IV antibiotics. And worst cases, you get an abscess, we have to do surgery. Hopefully you don't get to that point. If you have diverticulosis, diverticulitis, you're familiar, you get pain here, you see the doctor, nip in the bud. Alright, so we already touched on a lot of these areas, and I'll go over one more time because I think that's the crux here. Small meals more often. Now, decreasing the size of portion, instead of 3 large meals, if you can do 5 small meals. Why? The gut get chance to produce the juices. It's like I was talking to in the kitchen, you want slow and cooked food. Same thing in the gut. If you give 5 small meals, the cooking from the juices is much efficient. The gut doesn't have to hurry this big meal. Half of it goes undigested. You don't absorb the minerals, the vitamins from the food. If you have 5 small meals, it gives you've got enough time to say, okay, I got it. I have enough biliary juice, I have enough pancreatic juice, I got enough juices from my bacteria, I can handle it. But you, in a hurry, you want to just get it over, it becomes a problem. And the timing of the food is important too. So my professor of nutrition used to say, and I still hold true, eat your breakfast like a king, lunch like a queen, and dinner like a pauper. Why? Walking, exercise, movement, when you do the most throughout the day, right? You're not gonna take a dinner at 10 p.m., a big meal at Olive Garden. You're gonna go for a walk. You're gonna go to bed. So what's gonna happen to the food? You don't walk, the food don't walk. It sits there, and then you get heartburn and bloating, and you're passing gas, and your wife divorces you. So all because of the timing of the food. So think reverse pyramid. The big meal should be your breakfast, and we do other way around. We just have smaller breakfasts and big lunches and huge dinners because that's when we come from work, families around, friends come over. Just have a small meal. I know it's tough, but once you get used to that concept, your gut will be happy. So the timing of the meals is important, and we talked about smaller meals. We talked about fiber. Fiber is the gold. Why? It relieves constipation because it absorbs the water, and it softens the stool so they pass through easy. And believe it or not, fiber consumption reduces your risk of colorectal cancers. Think about it. The fiber has edges like a broom. So if you have a small polyp inside the colon and you got a stool which is very spiky because of the fiber, right? Because the fiber doesn't get digested, it has to come out. throughout your gut. So it's like you're grooming your inside of the gut like this. You're scraping it, so the polyp don't form. I've, 2-3 gastroenterologist friends, and they told me, over and over again, that people who are plant-based in their diet, the gut is squeaky clean. People who are rich in the meat in their diet, tons of polyp. Red meat by itself is a risk for colorectal cancer. But if you combine with fiber, so I'm not saying eat zero red meat, what I'm saying is combine with your veggies. Combine it with a salad, have this much portion of red meat. But the rest of the plate, so if you're looking at a plate which is like this, let's say, half the plate should be veggies and fruit. If your half the plate is veggies and fruit, you won't get any of these diseases regularly if you eat them regularly. And a big glass of water. So it's a profound statement. Half the plate is fruits and veggies, you won't get any of these diseases. And other diseases, for example, diabetes, cardiovascular health will be better, you'll have less strokes, and you'll have less dementia. What's the number one diet we recommend for people who have family history of dementia or memory loss? Is Mediterranean diet. What's Mediterranean diet? Let's break it down. Mediterranean diet is plant-based diet. Add some fish, add some olive oil, nuts and seeds, a lot of
Garlic.
garlic, lot of herbs. Good point. And that becomes a Mediterranean diet. So it's primarily a fiber-rich diet. Any of you guys heard about blue zones in the world?
Yeah.
Okay, this young man. The blue zones are in the world. There are 5 right now. They're adding one more later, where people live in their 100. They have longevity and quality. We got longevity in St. Pete galore in the nursing homes, but there's no quality there, right? These people are walking. These people are enjoying life. There's one in United States called Loma Linda. And what the common thing in all these blue zones, so there's Loma Linda, there's Costa Rica has a blue zone, Iberia and Italy has one, Okinawa and Japan has one. So what are the common things the scientists found in these people? Few things, which you all can take home and use it. 1, 95% of their diet is plant-based. All these zones. 2, very tight socially integrated communities. So churches, religious, friends, family, very tight. 3, all physically active. There's mass transit galore, and less cars, more walking, more biking, more walking, more biking, more walking. So, 3 things. Plant-based diet, primarily. They use local products like fish and all that in Okinawa and other places. Social integration. So if you're lonely, aloof, you'll die young. If you have friends, family, hobbies, activities, church, whatever, you live longer and healthier. We are social beings, humans. So, if you cut that piece out, it stunts you inside. And you'll find a path to die, whether cancer or stroke or heart attack, everything, dementia, big time. More than any drugs, what works for dementia is having social integration. If you push the patients into social isolations who have dementia, they die. The memory just collapses. But if whatever way we can keep them at home, you got to provide support. That's tough for the spouses. It's a 2-person disease, the dementia. It's not a 1-person disease. Anyone has experience with a loved one with dementia? Raise your hands. Yeah, so this young man knows. So it's a 2-person disease, the caregiver and the person. So you got to provide support. You can just say, hey, it's good to have social integration, but the society has to help them. Meals on Wheels, Neighborly Senior Service, Go Bingo. But these communities, the blue zones, have it built in, cultural. So if you take anything from my talk, if you take those three pearls, A, plant-based diet, half your plate should be fruits and veggies. Other should be beans from plant sources, protein from plant sources, like beans, tofu, flaxseed. You can put it on salad, So make it a complete meal. Put some olive oil on your salad, put some flax seeds, put some pumpkin seeds, whatever seeds you like, put some berries. You have fruits and vegetable galore and it's filling. Put some cheese, cottage cheese there. So you don't need to use meat products. If you want, you can have fish and water. No soda. If you drink soda, spit it out. I was talking to a friend who's a dietitian, and she brought a very interesting point. I give diabetic talks, so she's a certified diabetic educator. So I was just chatting with her when I was giving a diabetic. She was giving a talk on the diet aspect. I was giving a talk for the pharmaceutical aspect of in some forum like this. And she made a very good point. She said, Dr. Mahajan, have you noticed that since the fructose syrup got into American diet, we became more diabetic and obese and more heart disease? A very profound statement. If you think you go to a grocery store, any food does not have fructose syrup, you'll be surprised. Every damn food has fructose syrup. Why? Good shelf life, it tastes sweet, and we like sweet. And then if you don't like sweet, they put salt and butter. So the processed food and the fructose syrup, if you can stay away, it will help your gut health. Junk food make your gut junk. As simple as that. The microbiome don't like it. They say, hey, what you feeding us? This is what you're going to do to us? All right, I'm going to give you depression. There is a direct link of what foods you eat and how your emotions are. If you eat, think about it. If you get a good meal, by good meal, go back to the rule, half the plate is fruits and vegetables. You got some grilled veggies, you got some salmon. 1 hour later, you still feel good. You go to McDonald's, you get a nice fries, nice burger, you feel good for 5 minutes, 10 minutes. After that, say, shit, what did I eat? It creates bad emotions. Because the food gets digested like this, the super processed food, the restaurant food, now you're more hungry. The food with fiber, with the slow cooked food, the beans, the lentils, the superfoods, the hemp seeds, the flax seeds, the chia seeds. You can make smoothie. I'm okay with smoothie. Just put some spinach, put some chia seed, put some lime in that, apple, bananas, whatever. But don't throw the fiber away. Eat that too. Don't. People just say, oh, doc, I'm juicing. I said, okay, what you doing with the fiber? All that I'm throwing away. I said, you're throwing the most important part, the fiber. Fiber is gold. So please keep the gold. Don't throw the gold away. Water intake, we talked about that, 6 to 8 glasses per day. Very important to do these 3 things and you will have good gut health. So tracking. So food diary, we alluded to that earlier. We talked about dietitian. If it's hard to find a good dietitian, but if you have access to that, that's the weight in gold. And if your symptom persists and really the bad symptom, the blood in the mucus, changes in your bowel habit that can indicate cancer sometime in the colorectal area, severe abdominal pain that can mean obstruction. All these diseases left untreated cause strictures and obstruction in the gut. So you don't want to get to that point. There was a scientist that reminds me, I think Stanford scientist, he had Crohn's disease. So what he did was very yucky. He got the cyst of the tapeworms and ate those. Crazy idea. I'm not recommending it, but I'm just giving you an extreme example how the gut, and we, in this Western countries we get very sanitized. How is, if you look at the instance of Crohn's disease, inflammatory bowel disease in third world countries, it's right there, way down. In Western hemisphere, way up, because our foods become too sanitized, our environment become too sanitized. So that guy, crazy idea. What happened is now those cysts got infested in different kind, not just tapeworm, hookworm, all those kind of worms he put in his gut, and now they are in the gut, hooked up, and the gut is saying, "Shit, we got attacked." Now the gut, which was diseased, is worried about survival because of all the infestation. Suddenly the local immune system in the gut got profoundly, attacking those cysts and the small parasites, and the gut health improved. Though it didn't get cured, but the relapses got much, much less. So extreme example, but the point I'm making is whatever we do has an impact on the gut. If we get too sanitized with our food, if we eat too much junk processed food, we're going to have consequences in our gut. Alright, so unintentional weight loss, that's never good. It needs to be followed through. Heartburn after 3 months of taking Pepcid or Zantac or omeprazole or Prilosec, whatever, is not getting better. It could be Barrett's esophagitis, that's a precancerous condition of the esophagus. It could be H. pylori gastritis, could be cancer of the stomach. So 3-4 months, over-the-counter stuff, prescription stuff, you're not getting better, it's a good idea to get endoscopy. Again, we get embarrassed about gas, we get embarrassed about your stool. Hey, it's your own stool. So talking to your provider about these conditions should be as you're talking about hair loss. There's no embarrassment about symptoms, and we've seen a lot of shit. So don't worry about it. So talk to the provider if you have any of these serious symptoms. Those are outliers, and if you have them, you should not let it slide. Alright, so in review, what's the moral of the story? The moral of the story is, as this young lady said with her wisdom, everything is connected. The mind is connected with your body, the body is connected with your gut. If you do poor lifestyle, you'll not have good gut health. As simple as that. So if you take one thing from this talk, walk 30 minutes 5 times a week. Drink 6 to 8 glasses of water a day. Don't throw the gold away, which is your fiber. If the food does not have fiber, spit it out. Processed food has no fiber. That's why it's quick. How can you turn to the drive-through, and by the time you come to the window, you have a food ready? Because the only way they can do that is by taking the fiber out from the food, and they can make it quick. So if you know the food is cooked quick, run. It'll help you exercise by running. Plus, you won't eat that processed food. And last not the least, if you have any of those serious symptoms, talk to your healthcare provider. It may not be just anxiety. Sometimes patients come to me and they say, "Hey doc, I've been losing weight. Lost my son," and that can be, sure, for a parent to lose their child. But after a year, yes, if you're having constipation, you never had constipation. That's something we got to follow through with stool tests, with colonoscopies. Any questions?
Also, what do you think of magnesium?
Right, so the magnesium is excellent for improving your gut motility. So some people take magnesium citrate, mag citrate. Some people take magnesium oxide. It helps them calm, it relaxes them. The CalMag is another combination they take. But like anything else, if you overdo it, it's going to hurt you. So if you're taking a diuretic, for example, Lasix or Bumex or chlorthalidone, yes, take a magnesium supplement because it pees out the magnesium in your urine and your potassium too. But if you're not, the body gets enough magnesium from the food as long as you eat a well-balanced diet.
Yeah.
Yeah. So I won't go towards adding that unless you're on diuretics. Yes, sir.
What about plant-based food that's tastes like meat? You know, they probably, what is that?
Very good question. So I get this question quite a bit. It's what I call a transition diet, the plant-based meats. Why? The plant-based meat, if you look at the composition, and they come in different variety now. Sausages are plant-based, chicken is plant-based, beef is plant-based. The problem with that food is it's rich in fat, very poor in fiber. Yes, it's plant-based. So if you're transitioning from burgers from McDonald's or Burger King, whatever your brand is, to plant-based diet, it's a good transition. It's a good landing spot. But then don't overdo it. It's rich in fat, not a good long-term strategy. But yeah, or 1 or 2 burgers a week, absolutely. Patties from that are good. So yes, if you want to, taste is okay. We're creatures of taste. We start tasting when in our mom's womb. So those tastes are hard to get rid of. If I tell someone, hey, take plant-based diet, easy said than done. You've been on 60, 70 years with that taste in your mouth. It's not going to be easy. So that's a transition food. Good to have once a week, twice a week, replacement for meat, but not should be a main staple diet for the rest of your life.
Okay. Thank you.
No problem. Any other questions? All right, so, yes, sir.
You said that CAT scan CT scan is one of the things that you might utilize as a tool. Does that see soft tissue? And what does the internist or GI see that helps them diagnose something?
Very good question. So the CAT scan is a glorified X-ray. You don't want to get too many of those because it's really a lot of radiation in that. So yes, it looks at your soft tissue if you take it with contrast. So you have to take double contrast intravenous, and if you're allergic to iodine, then you have to take a protocol so you don't get allergies, and barium. So if you take both contrast, then you get a beautiful view of the vasculature, the lining of the mucosa. Just a plain CAT scan is but if you combine it with the 2 dyes, the intravenous and the oral, you get a beautiful view. And then you get a flow of the barium too. You see the flow where there is obstruction. So you get a Newman view, that means the colon and small bowel, you see flow. And then intravenous, you see the outside view. So it gives you a beautiful picture. Yes, sir. Any other questions? If not, thank you for your attention.
Thank you.
Appreciate